Hey, and happy new year. Today we are talking about compression tights for POTS, or postural orthostatic tachycardic syndrome, and reviewing a hot off the press article that really looks at the impact of high-waisted compression tights on POTS symptoms. So I'm really excited to talk about this and kick off the new year with a great article. If we haven't met before, my name is Julie Hirschberg. I'm a neurologic physical therapist and the owner and founder of Reactive Therapy and Wellness in the Los Angeles area, which, by the way, today there are these terrible fires in this area, really high winds, very unusual weather for the winter. And I just wanted to say a special little prayer and love to many of our patients that live in areas that are experiencing fires right now. So that is what's happening here in Los Angeles. But also happening is talking about compression wear. Now, I want to give you a personal piece. I have a personal interest in this, and I actually brought a ton of compression wear to show you because somebody reached out and asked what types we might recommend. I do not have POTS. I do have very severe orthostatic hypotension. I'm actually going to cardiology this month to help figure that out, but I get really low blood pressure, which causes me to faint or my brain not to function really well in standing. So I wear compression wear. Not for the same reason that a person with POTS might wear compression wear, but what this study did, which was helpful in POTS, would also very likely be helpful for other people with orthostatic hypotension or orthostatic intolerance, orthostatic tremor even. And as a neurologic therapist, and I see some of my fellow clinicians here as well, these could be really helpful for people with Parkinson's, for example. So much that we can learn from one article. So let me share this article. Here we go. It's called A Community-Based Trial of Commercially Available Compression Tights in Patients with Postural Orthostatic Tachycardia Syndrome. The first author is Kate Bourne. They are out of, I hope I get this right, I think it was Calgary. Yes, it is. It is from Calgary, but also there's folks from Vanderbilt University on this this study. And I honestly think this is such a well done study. It's very practical because these are just commercially available compression tights. They did it with patients in their home, meaning they sent a EKG 3-lead monitor for them to wear. They had them do a standing test and try things with and without medication to see the response of their heart rate. It's very practical. I think so practical, like, wow, we could do this with folks at home all of the time. And I just want to show it. The Zebra PT is saying, got my compression pants under my scrubs today. Yes, we do. I am almost always wearing compression pants or some sort of compression garment myself, just so I can function. Thinkies and Feelies says, I have POTS and F&D and I definitely should wear compression garments, but they feel so itchy to me. Thank you for that comment. This is probably one of the number one barriers that I see to compression wear is the sensation of it. So I did share, I also don't like a lot of sensations of different types of materials. I can be very sensitive to them. So I am going to share some examples that I personally have found really helpful and that some of our patients have found helpful. And I'm going to share, we created a guide from our team after many years of working with patients with links and suggestions for different types to try. I'm not affiliated with any company. This is just from personal and clinical experience. Something else I want to say, because I've been working on this today, we are going to be doing a workshop next month. We haven't announced it yet, but it's on the sensory system and POTS and EDS. And sometimes some of those things can be training and addressing the sensory system can allow you to wear the compression. So just keep an eye out for some of those things that could be coming up from us. We're going to do a little workshop for you all. But let's talk about this study. This is what I love. This study included this little central illustration is what they call it. But it is essentially the study in a nutshell. And I love this. I love a good visual. But what you can see here is compression off and compression on, right? So what they show that occurs in standing is you get blood pooling in the lower half of the body. So with the compression off, you kind of see this visual of the red blood pooling. Compression on, you see blood return to the heart, pumped up to the brain. This actually decreases. So if you see HR on the side, when the person is wearing compression tights, and these are waist high, so these are high waisted compression tights, their heart rate decreases as their stroke volume increases. So without the compression tights, lower stroke volume, and you get a result of a high heart rate. This is what you have in POTS. When you wear the compression tights, it increases the stroke volume, lowers the heart rate. That's it in a nutshell. But I got to tell you about the study, of course. So what they did, I'm going to share another diagram here that shows what they did. Again, oh no, I did not capture this diagram for you. Okay, so I'll walk through what they did. And it was really simple, actually. So they had a 3-way EKG. They asked people first to take orthostatic vitals, meaning take their heart rate as they were going from lying down to standing without medications, because many people with POTS take medication. By the way, they're very effective. Without medication. So they do the test without medication. Then they put on the pants, and these could either be medical grade or just commercially available compression wear, not just compression socks, not just an abdominal binder, but compression pants, compressive pants. And then 30 minutes later, they're wearing this and they take they do the test again. And the test, by the way, is standing for up to 10 minutes. Now, not everybody could stand for 10 minutes, but for up to 10 minutes, and they were looking at the heart rate response. Then they had them wear them for 3 hours. Then they did a measurement in the afternoon. I love that they did this because there is a normal diurnal change in heart rate that occurs just normally throughout the day. So they tested it again with them on and then tested them again with them off. So there's these 4 times. They also did this with and without medications. And this was so smart, of course, because these folks study POTS all of the time and they're really smart, but this was so smart because they could see the effect of the compression garment was higher when the person was off of medications, because the medications are already really helping the stroke volume and the heart rate for the person with POTS. Which is a good reminder that if a person has POTS, they should be managed by somebody who understands that and can understand it's off-label at this point, but off-label medication management that can be very helpful for people with POTS. So they did both. And I'm going to share with you the results here. I think they're really nice to see. I'm going to pull them up big on my screen. I know they're a little smaller there, but I'll try to describe it for you. So the first is the difference, what you can see in the red line and the blue line. These are looking at both with the compression on and the compression off. So the blue being on and the blue being off and the red being on. When a person has POTS, we would like that heart rate to go down. They're tachycardic. We want to bring the heart rate down. And what you can see very significantly, the heart rate goes down with the addition of the compression tights. That's a really nice decrease in heart rate. So you can see kind of an average where it's, and you can see it over time too, by the way. So you can see that's over the 10-minute time. You can see that average above 110, and you can see an average dip down to that 100 area. So what is this A, B, C, and D? So the C and D are the PM, let me make sure that is right. Is that correct? Yeah, so this is the PM, on and off. And then D is the delta meaning the change. So the first is just the heart rate. The second is the change. And again, we can see the delta heart rate, standing minus baseline much lower in when you're wearing compression wear. This is significant. Both of those findings were significant. So something that I always have to share too is who was included in the study. So the study was 26, I believe, 26 people with POTS. They were all female. We know that POTS is more common in females. The average age was 36 years old. And they had physician diagnosed POTS, meaning they met the criteria of greater than 30 beats per minute, of increase in heart rate within 10 minutes of standing. And I will say, actually, 23 of the participants actually met that when they did the testing. 3 of them did not on that day of testing. Almost all of the patients were taking medications, and they talked about what they were taking. And I thought this was helpful to see. I think this is what we most commonly see in our POTS program as well. They were taking beta blockers, 71% of them, midodrine, 31%, methyl-dopa, 12%, and pyridostigmine, 12%. So the beta blocker was the most common that people were taking. And again, they actually did the testing with and without the medication, and the compression garment showed a more improvement when the person was off of medication. That kind of makes sense because they're not on medication. And so there's less of a change in heart rate when they're on medication. Something else that they did actually compare is a lot of the participants were medical grade waist high compression. So I think it was 17 of them. And the other 9 were wearing more sport related compression. So they could actually compare those, and the medical grade, which would be a higher level of compression, did actually have a little bit more of a response. So very, very helpful. Some of the other things is that they asked folks about their symptoms. So most participants had worse POTS symptoms when they were off of medication. No surprise there to me at all. But some of them actually had better symptoms off of their medication. So maybe that's not the right medication for them. They didn't really talk about that, but I think that would be something to consider if somebody went off their medication and they actually felt better. People also reported feeling better with the presence of the compression. No kidding, their heart rate was so much better with the compression. So what does this tell us? This tells us that People can use simple things like compression to improve their symptoms and improve their heart rate if they have POTS. This can allow them to stand up longer, live life, do the things that they want to do, just tolerate being upright. And in this study, I forgot what the average was, but I just saw it up on the study. It was 14 beats per minute improvement in their heart rate, and that's really very significant. That is the difference for somebody definitely feeling better. So I want to get to your questions, and by the way, feel free to ask away. I'm going to stop sharing this, but folks had definitely asked about different types of compression. Now, this was not in this study, but this group has studied other forms of compression before, and abdominal compression is the most effective. That's because there's a ton of blood flow through our abdomen. And so I wanted to share with you, it's kind of folded up here because I wear it all of the time, my particular favorite abdominal compression comes in a bodysuit. It's super duper soft. That's why I love this. I'm not affiliated. I'm not doing a commercial. The brand is called Honey Love. And I had tried out some other things that I found a little restrictive. What I like about this, again, is that it's thick enough for compression, but it's really soft on the inside. I don't know if you can see that, but this is just a body suit. It's something that I almost wear every day myself if I can't wear compression pants. Somebody else, Honey Love. Yeah, Honey Love is the brand. There are other brands of compression. I've tried a lot of things from Target, to be honest, because it's inexpensive, and there are some compression shorts that haven't been too bad. And this is what I would just recommend. I recommend you try several different brands to see what fabrics and things that you like. Somebody else asked, would you recommend an abdominal compression or something like a legging style compression? So I think it depends. I like to wear all kinds of pants, so I might wear abdominal compression when I'm going out, when I want to wear pants, when I want to wear a skirt. Abdominal compression is extremely effective. Pants, waist-high compression pants seem to be next. And speaking of Honey Love, again, I'm totally not affiliated, but they have, these are not tights. So they're just compressive more around the abdominal area. And they're like cute pants with like pockets and things. So I got these after I got my abdominal binder. And again, they're soft, they're stretchy. They're not compression pants, but they have compression in the abdomen, and they're kind of cute. They don't look like athletic pants. So that's just another option. Things that people have liked that are just sport related are just like running tights. So this particular study didn't say what brands they were looking at, but I would imagine maybe they had some Athleta ones or some Lululemon ones or some Target. I like the ones at the highest compression because, again, they are compressive and therefore I am getting more blood flow. Again, I don't have POTS, but I have very, very low blood pressure. So these are really helpful for me. But these are the kinds of things that they did in this study. These particular ones I absolutely love. I got them recently. I had an old pair, but I love them because they're soft. These are the Salutation, I'm like looking at the tag here, Salutation Stash Type, because I also like my pockets from Athleta. And I get them small, even though I'm not necessarily a small person, but I get them small so they're tighter. And these are high-waisted, so really nice abdominal compression. I feel like I'm doing a commercial. I swear I'm not. People had asked about things. Now, what's nice is, again, you could try these on. If the fabric doesn't work for you, that is the softest one that I've had. But if the fabric doesn't work for you, return them and try a different one. So these other ones, this is the highest compression that you can get at Lululemon. And this is the Wonder Train tight. And it has extra compression. I have it inside out so you can kind of see it. It has extra compression in the abdomen. I love the compression of these. I don't like the fabric as much as I do from these other ones. So I'm just gonna say that. Now, I also run every day. So I'm wearing these tights every single day for exercising, for recovery, for work. So I do happen to have a lot of pairs because I wear them a lot. The one thing I would say, if this is new for you, you want to consult with a physician. I would never be adding abdominal compression and compression tights for somebody that had high blood pressure, because this would raise their blood pressure, and that would be contraindicated, right? So as a clinician, if I'm working with somebody and trying these things out, I'm gonna actually be monitoring their blood pressure to look at the response. Because if a person, let's say, like me, has really low blood pressure in standing, but it's kind of high in supine, I might need to not wear these while laying down. Now, that's not the case for me, but I've had numerous patients with Parkinson's where they have such fluctuating blood pressure that they cannot lie down with an abdominal binder on. So there's not a lot of risks in compression wear, but the only risk would be a really volatile blood pressure. Okay, I see some comments and questions. Is it supposed to go from legs to the abdomen? Yes, so in compression wear and compression tights, we're looking at compressing and increasing blood flow back to the center, back to the core, back to our brain, so we can feel better. And the best compression is in the abdomen. So if we don't do anything else but just use compression at the abdomen, that is our best case scenario. The compression tights also, according to this study, and I've seen it across the board clinically as well, and felt it myself, the compression tights also can provide a great deal of compression and help with heart rate in POTS, and help with blood pressure if you have orthostatic hypotension or orthostatic intolerance. It does not have to be from the legs to the abdomen to provide that help. It could just be the abdomen. I was going to say I didn't have them out here, but Spanx, because that's another type of body wear, they make some really cute, like shiny, glittery leggings that are compressive. So you can have fun with this too. So I'm just going to make sure I captured any other questions and things. But Julie, that was for you. You had asked about specific things that can be helpful. When I am working with a person, the first place I will start is abdominal compression. And again, a lot of abdominal binders and things are quite uncomfortable fabric. Now, I'm usually putting them on outside of clothing, but they're still just usually an itchy, scratchy type of fabric. Some of the bands that have been made for women postpartum are softer, and I think those can be really helpful. And again, I like a good bodysuit because it is usually made out of a very soft material. And again, one of the biggest barriers for a lot of folks to wearing compression wear is that the sensations or even the heat of the compression wear is intolerable. Now, that can be for many reasons. That could be part of the autonomic dysregulation. It could be part of the sensory integration or sensory processing for the person. And what I want to share with you is that it doesn't have to be that way, and it doesn't have to be that way forever. Sometimes you are experiencing some of that touch sensitivity due to nervous system dysregulation and sensory system dysregulation, or some difficulty with sensory processing or integration. That doesn't have to do with just touch sensation. It might be related to other sensations and how they're integrating in the nervous system. So that's not the topic for today, but I wanted to share that because so many people struggle to find something that really works for them. Sometimes the answer is to assess and address the sensory system first so that you can tolerate wearing different pieces of clothing and being able to actually wear compression garments. And that's like a teaser for a workshop that we're doing next month on the sensory system that's for people with EDS and POTS. So stay tuned, that is coming. And then I also wanted to share this, that our occupational therapist, Dr. Naoya Ogura, who leads our EDS and POTS program, who established us as a center of excellence in EDS, created this guide specifically for you. So it's a compression wear 101 guide, and it talks about why you would wear compression wear, what types of compression wear you could wear, and what brands and different types that we have recommended. And he added to this, so there's a series of emails that goes out with this. He added a link that includes all of the different types. So if you were looking for a very easy way to quickly research these, this would be one particular way. So you can download this right off of our Zebra program website. It's at reactivept.com/zebra. But you could also, we have several posts, like throughout the week, where if you comment compression, we'll send you the link for this. But we created this because so many people had told us they've spent so much time on this, and we really wanted to save time on the scrolling and the research. So we put all of our research into this guide. And I had another therapist tell me today that she gave the guide to one of her patients who was really needing some compression wear. So yes, all my clinician friends, you can download this. You can freely share it with people. Because as we found out, so I'll just bring up this study one more time, as the study confirmed, like we already knew this because we've been doing this, but hey, I'm not a researcher and I didn't get to do this trial. So very thankful for the folks researching and putting the effort into this and doing really great trials like this one. But we know that commercially available waist-high compression garments provide a decrease in heart rate for people with POTS and improve their symptoms. These benefits also, by the way, I didn't talk about this, but these last for a long time too. So this is a really important part of management of POTS, and all people should have access to this and have a few tools in their toolbox so that they can keep living well with POTS. So that's why we created our compression guide. That's why these folks are doing this type of research too. I think it's really important research to share. So I will share this study. By the way, it's free full text. I will include it in our newsletter this week. If you are not on our newsletter, we have a clinician newsletter that goes out every Friday. I include links to articles, resources, our videos from the week, and that happens every single Friday. For clinicians, you can sign up at reactiveeducation.com. For patients, you can sign up at reactivept.com, and every Monday I send out the newsletter. I'll send out links to this, links to our guide, all of the resources for you every single week. And I just want to say thank you. Thank you for the great questions. Thank you for getting curious about the brain and body and wanting to learn more, whether you're a patient or a clinician. Oh, also, by the way, I wanted to give a big shout out. Emily Rich is an OT based in Arizona. She's phenomenal. She has a course, by the way, for clinicians on POTS. So if you're a clinician wanting to learn more, you should check out her course. But she and I share a brain, I think, sometimes, because just yesterday she posted a really lovely review of this exact article, which I already had waiting for me to talk about today. So I was really stoked about that. She posted a lovely review detailing all of the outcomes in this study. If you're not following Emily Rich, you should. It's at Emily Rich OT, all one word, at Instagram. So that's her Instagram. You should follow her. She shares amazing information. So I highly recommend her, and I just wanted to give her a shout out. So as usual, if you have questions, send me a direct message, comment. I'm happy to respond. And thanks again so much for joining me today, this first live video of the new year. I hope you have a wonderful evening, and I will see you again soon.